Virus infection. Respiratory Syncytial Virus, RSV, is a highly contagious virus that mainly affects the lower respiratory tract. It is very common at any age, but most often impacts infants and young children or older and immunocompromised adults. RSV spreads through respiratory droplets from coughs or sneezes of an infected person and by direct contact with contaminated surfaces. The virus enters through the mouth, nose, or eyes, predominantly infecting the bronchioles and alveoli of the lungs. RSV is most prevalent in the cold months of winter and early spring. Mild RSV symptoms. When RSV enters the body, it targets the cells of the respiratory tract. First, it infects the upper respiratory tract and then spreads either via mucus or through cells to the lower respiratory tract, particularly the bronchioles and alveoli in the lungs. In response, the immune system mobilizes white blood cells to fight the infection, causing inflammation and increased mucus production in the affected areas. This immune reaction leads to signs and symptoms including times congested or runny nose, times coughing, times sore throat, times mild fever. Older children and healthy adults usually recover on their own after the 1st of February weeks. In young children, infants, and elderly or immunocompromised adults, the infection can be more severe, leading to bronchiolitis and pneumonia. Young children and their families are at the highest risk of being infected due to exposure in childcare environments. Severe RSV in children. Young children and infants have smaller airways. RSV infections impact them more severely because their lower airways can more easily become obstructed or blocked. Mucus plugs are formed by the excessive production of mucus, sloughing of dead cells, and inflammation of the lower airways. This leads to respiratory obstruction. If enough pressure is created, the alveoli, tiny air sacs in the lungs, beyond the blockage can deflate, leading to respiratory distress. Severe RSV in young children and infants presents with signs and symptoms including times persistent or severe cough, times wheezing, whistling sound during breathing, times difficulty breathing, times cyanosis, bluish skin color due to lack of oxygen, times high fever, times unusual tiredness or irritability, times decreased appetite, times otitis media, ear infection, times bronchiolitis. Times severe cases of RSV lead to bronchiolitis, a respiratory condition in which the bronchioles, tiny airways in the lungs, become infected and inflamed. This is especially common in young children and infants. The virus infects the cells lining the bronchioles, causing the tissue to swell and become inflamed. Some of the infected cells also die, sloughing off and mixing with the mucus in the airways. Times RSV spreads within the body by passing through the cell wall to neighboring cells in the respiratory tract. This creates large cells that contain multiple nuclei. These fused cells are called syncytia, which is how the virus gets its name.